Great to join you. I'm based at the Center for Public Mental Health in the Department of Psychiatry and Mental Health here at the University of Capetown. And we've been going as a center for about 2 or 3 years now. And although many of us have been working in the area of mental health policy and services for quite a bit longer, during the last couple of years, we've been lucky enough to be awarded a couple of large international research collaborations, and I really just wanted to describe these to you, particularly focusing on 2 projects. The one is called PRIME, which stands for the Program for Improving Mental Health Care, and the other is FIRM, which is one of the NIMH-funded collaborative hubs. So PRIME is a DFID-funded research consortium working in 5 low and middle income countries. And we are working in Ethiopia, India, Nepal, South Africa, and Uganda. And in each country, we have a research partner, which in most cases is an academic research institution, and a Ministry of Health partner. And that Ministry of Health partnership is really critical to the success of the whole project. We've been going for about 2 years now. It's a 6-year project funded for £6 million. And I say the Ministry of Health partnership is critical because we really involved Ministry of Health partners from the outset. Even before we were awarded the grant, we got some seed funding to have a meeting, and we invited Ministry of Health partners to that meeting, and we asked them, what are your research priorities? What are the policy questions that you needed in order to strengthen mental health systems and services in your country? And that's really informed what has been a very close working relationship between researchers and policymakers. So just briefly to summarize, the program, as I said, runs over 6 years and is divided into 3 phases. The first phase was an inception phase in year 1, which we established the partnerships and conducted situation analyses and formative research in each of the country district sites. We have 1 district site initially in each country. And then we followed that up with what we've called an implementation phase for years 2 to 4, which essentially involves developing a mental health care plan for the integration of mental health into primary health care in each of these district sites. So that's involved conducting theory of change workshops with the district health management staff, and developing a mental health care plan that operates at 3 levels. At the healthcare organization level, ensuring that the adequate budget is in place, that information systems are in place, that support structures are in place to deliver packages of care. Then secondly, at the health facility level, ensuring that staff are trained and there's adequate supervision and drug supply to deliver evidence-based interventions, largely based on the WHO MHGAP intervention guidelines. And then the third level is at the community level, in which we're engaging with community-based NGOs and with local community-based psychosocial rehabilitation groups to deliver intervention packages and detection packages. We're focusing on 3 priority disorders: depression, alcohol use disorders, and psychosis, although in some countries, 2 countries are adding epilepsy as a priority condition. So the idea is at this stage that we're in the stage of piloting these intervention packages, and during the next 6 months we'll be rolling them out and embedding them in each of the district sites, and then evaluating them, and we're using a number of different evaluation designs to evaluate the packages. First of all, we are doing repeat community surveys of a random sample, a representative sample of the district population. In some countries, we've already completed this initial community survey, and then we'll follow it up 3 years later. And essentially, we're trying to measure the coverage of mental health services to see if there's any impact on the treatment gap during the 3 years of implementing these mental health care packages. We're also looking at a number of other issues related to stigma and barriers to care. The second evaluation design is a facility detection survey to assess whether the introduction of these mental health packages improves detection rates and diagnostic practices among primary care practitioners. The third study design is a cohort design, so we will be taking approximately 200 people for each of the priority disorders in each of the countries and tracking them over a year to look at their clinical, social, and economic outcomes as a result of receiving packages of care in these district sites. And then fourthly, we'll be using a case study design to describe the packages, how they're implemented, the systems that need to be put in place for the effective integration of mental health into primary care in these low resource settings. So that's really an overview. We also have a strong emphasis on capacity building within the consortium. And we have a number of PhD students who've embedded their PhD work in the research of Prime. And for those of you who are interested, you can have a look at our Prime website. It's at www.prime.uct.ac.za, or just Google Prime Mental Health and you'll find us. Then the second major project we're involved in is one. What's that?
1 minute.
1 minute, okay. 1 minute to describe 19. So this is the AFIRM stands for Africa Focus on Intervention Research for Mental Health. It's one of, I'm sure many of you are familiar with the NIMH U19 collaborative hubs. So this is one of the two that's been awarded in sub-Saharan Africa. And we basically have a research focus, which is mainly constituted by 2 randomized controlled trials, one conducted in Ethiopia and one conducted here in Capetown in Khayelitsha. And they both focus on the same theme of task sharing. But in Ethiopia, we are focusing on severe mental disorders, and in South Africa on maternal depression. And then in addition to that, we are running a capacity building program, awarding 5 fellowships per year to attend our master's program in public mental health here at UCT in Stellenbosch. And we are hoping by the end of the 5 years of the program to have 25 master's graduates across 5 countries that we are supporting. And the countries are Ghana, Uganda, Ethiopia, Malawi, and Zimbabwe. So that's a 1 minute précis of AFIRM. So again, you're welcome to Google us and have a look at our website. Thanks very much.